HIV is our topic. I'm Demebi. Next slide, please. So HIV is a virus that attacks the body's immune system, specifically the CD4 cells, and it makes your body too weak to fight off infections. It can be transmitted through sexual contact with someone that already has HIV or from mothers to their babies. And people with HIV have similar symptoms to the flu, such as swollen lymph nodes, night sweats, and ulcers. Next slide, please. And so as you can see from the graph on the left, mortality rate as well as incidence rate for both male and females are decreasing over the years. And this is because of the ART program, which helps people that have HIV and AIDS live for a longer period of time. It's higher for those living in the Northeast as well as the West. Next slide, please. So risk factors for people living with HIV include lack of access to medical resources, as well as education and gender, as well as food inequality. Next slide, please. So about 1 in 7 people in the US actually have HIV, and this is because of, male to male sexual intercourse. As you can see on the graph, they have a higher chance of having HIV, and having sex with someone that already has HIV, or it could be the place of living, as well as unprotected sex and use of needles to inject drugs, and etc.
I am Dorothy, and this is how the public and global health system have been trying to deal with HIV. So in 2016, the UN, they have a declaration to have some countries committed to the 90-90-90 goals. So basically in these goals, they want by 2020, 90% of people living with HIV would know the status, 90% of people of those who know the status are accessing treatments, and 90% of those accessing treatments are virally suppressed. However, by 2020, they only reached 81%, 82%, and 88%. So they did not meet that goal. And they were saying that most of it is probably because of COVID. That's when it started in the beginning of 2020 that stopped the progress. However, in America, President Trump have his own plan for ending HIV epidemic, a plan for America. And in this goal, we're hoping that to lower the HIV rate nationwide by 75% in 5 years and 90% in 10 years. And in this, they try to use the right tool and to diagnose, treat, prevent, and respond. And some of these tools are the AIDS cocktail or antiretroviral therapy, which tries to prolong the life of those who are affected. And then the pre-exposure prophylaxis for the people who are at high risk for HIV. And there's also the syringe services programs, which exchange out used syringe from poor people who can't afford it and give them clean syringe to use. And then these are some few key strategies that I mentioned before, which is diagnose, treat, prevent, and respond.
HIV is a global public health issue killing 33 million people worldwide. Information about HIV is available, which has reduced the spread of the condition and the associated mortalities. It is accessible through the World Health Organization website, including the modes of transmission, signs, symptoms, risk factors, diagnosis, testing services, and prevention. The government provides information on how people can seek treatment for HIV through their website, where individuals can get a doctor and other support services related to HIV. Planned Parenthood is a health center that offers treatment for people with HIV. People can also seek medical care from HIV clinics, community health centers, veteran affairs clinic, or even a private healthcare provider. Some people believe that HIV can be transmitted through kissing, which is not true unless one has a bleeding sore. There is also a belief that one can tell who has HIV by looking into their eyes. Healthcare professionals should address this misconception by encouraging people to take an antibody test, which is the only way to determine whether an individual is HIV positive or not. Other common misconception about HIV is that people who test positive for HIV cannot have sex with people who test negative. However, this is not true, as medication can lower the viral load, reducing the chances of infecting a partner. Besides, public health practitioners should consider educating people to use a protection for a safer sex and introduce infection chances. Thanks for watching.